Hi everyone, Jen Angot from Marketing and Communications, and today we are continuing our video series on Heart Month. So today we've got Dr. Huiting Chen from Henry Ford Allegiance Vascular Surgery joining us. Dr. Chen, thank you so much.
Thank you for having me.
Perfect. So why don't you start out by telling us a little bit about what you do?
Sure. Good morning, my name is Huiting Chen. I'm a vascular surgeon at Henry Ford Allegiance Health, which means I am a surgeon who operates on blood vessels.
So tell us the difference between vascular disease and heart disease.
So the difference between vascular and heart disease simply comes down to the location of the disease process. So heart disease is in the heart and it's located specifically here, but there are so many blood vessels that go to all parts of the body, and that encompasses more of the peripheral vascular part of the disease. So blood vessels go to your neck, your arms, legs, bowels, and kidneys. And these are the arteries that I treat.
So what are the symptoms of vascular disease?
The symptoms of vascular disease a lot of times depends on which arteries are affected and how exactly they're misbehaving. The most common symptom that I see is from poor circulation down to the legs. So in those folks, when they try to push themselves to walk, sometimes even a short distance like a block, they have severe pain and limitations in what they're able to do and really have to bring themselves to rest before they can pick it back up again. And I see that very frequently, and it's something that I treat very frequently.
So what are some things that we can do to kind of help keep ourselves healthy and to keep vascular disease at bay?
Sure. There are a lot of things that we can do to try to minimize our risk and symptoms of vascular disease. One of the number one things is smoking. Those who quit smoking decrease their risk of vascular disease and decrease the symptoms that they have if they already have vascular disease. And there are a number of other things that can be helped too. For example, high blood pressure is another risk factor that plays a major role in vascular disease. And overall healthy lifestyle choices.
Great. So if someone wants to be treated or screened, if they're concerned that they have some issues going on, where can we go?
Oh, absolutely. So I'm very dedicated as a member of the Henry Ford Allegiance Hospital to serve the community, both here in Jackson, where I have my clinic and operate, but also I have an outreach clinic in Mason too, to make it easier for the patients in the greater Mason area to have access to care. And so not only do I go out there to make it easier for them, but I also bring the vascular lab out with me so that they can have ease of having their vascular studies and see me on the same day, all without having to come down to Jackson. So I try to make it easy for them to see me and to get their questions answered and get the care that they need.
That's really great to just see the level of care that we're doing for our patients. So thank you so much for tuning in. And Dr. Chen, thank you so much for sharing your knowledge with us. And
Sure.
We'll see you next time.
All right, thank you again.